is I have removed the skin on the right side of our anatomical model here, and we can already see that deep to the skin there is some connective tissue, right? So this is not going to be the only type that we have here. This is the subcutaneous tissue of the neck. This layer here is actually pretty fatty, but there's actually also a deeper one. So in a nutshell, what we need to learn and understand is that these structures in the neck are going to be surrounded by a layer of fatty subcutaneous tissue, which we will call the superficial fascia, visible right now. I'm going to go ahead and hide that. And they're also surrounded by a layer of deep fascia. It's called deep cervical fascia. And the function of the deep cervical fascia is to compartmentalize the structures in the neck. So basically what we have is we have fascial planes that arise, and these fascial planes are clinically very important because they can determine the direction in which an infection in the neck can spread, for instance. So now let's briefly touch on the deep cervical fascia, all right? So the deep cervical fascia will consist of 3 different distinct layers. The first layer is going to be called the investing layer. Then you will have a layer of pretracheal, and then prevertebral fascia. And these here will support, for instance, the muscles, the vessels, the viscera in general, and the deep lymph nodes in your neck. Also, these fascial layers will help provide the slipperiness so that the muscles can kind of glide over each other, because even like very trivial actions like swallowing, due to the pull of the infrahyoid muscles, would be hard, and you would have muscles rubbing on each other, which leads to irritation, inflammation, and possibly a kind of bursitis otherwise. So this is why it's important that we have all the fascia here. In addition to that, clinically relevant would be that the fascial planes also form a natural cleavage plane, which is important for surgery, but also important for the dissection process. The first layer is called the investing layer of deep cervical fascia. This layer is the most superficial layer of the deep cervical fascia, and it'll surround the entire neck. It's deep to the skin and deep to the subcutaneous tissue. At several places, it'll actually split into 2 different layers, and they will then enclose or invest muscles, for instance, the sternocleidomastoid and the trapezius. The second layer of deep cervical fascia would be called the pretracheal layer. This is limited to only the anterior part of the neck, and it extends inferiorly from the hyoid bone that you can see up here, all the way down to the thorax, where it will then actually blend with the fibrous pericardium. If we had the heart here, it would be right about here. The pretracheal layer has a thin muscular part which will cover or enclose the infrahyoid muscles, and then also a visceral part that will cover the thyroid gland here, for instance. And in addition, also the trachea and the esophagus. Interestingly enough, this pretracheal fascia will actually be continuous with a type of fascia which is above and behind it, or posterior superiorly, which is called buccopharyngeal fascia, and laterally it'll blend with fascia which contributes to the carotid sheaths. The carotid sheaths will be containing 3 important structures: your internal jugular vein, the vagus nerve, and the common carotid artery. And it's important to be aware of the fact that the carotid sheath that surrounds these 3 named structures here, together with the pretracheal fascia, can communicate with the mediastinum all the way down here in the thorax, but also superiorly can communicate with the cranial cavity. And once again, this is important to remember because that means this is how they can spread infection or, for instance, extravasated blood. Last but not least, we have the prevertebral layer of the deep cervical fascia. So as the name implies, the prevertebral layer is going to be in front of or anterior to the vertebrae, and it kind of forms like something like a tubular sheath that engulfs the vertebral column and the muscles that are associated with it. For instance, muscles called the longus colli muscles and the longus capitis. This prevertebral layer is going to be fixed to the cranium superiorly, and inferiorly it'll kind of fuse with the anterior longitudinal ligament, which we should be able to see on the anterior aspect of the vertebral column right here. Laterally, this layer of fascia is going to extend as something that we call the axillary sheath, which will be the fascial sheath that surrounds the axillary vessels and the brachial plexus, the beginnings of which you can see over here. As we're already talking about spaces, we also need to talk about a space which is behind or posterior to the pharynx, so we'll call it the retropharyngeal space. This is important to know because actually this is the largest and most clinically important interfascial space in the neck because it is the major pathway for the spread of infections. It is like many spaces, just a potential space, until we actually have something going on in there, like an infection. In a non-pathological state, it's just going to be filled with some loose connective tissue that is going to be between the visceral part of the prevertebral layer of the deep cervical fascia and this buccopharyngeal fascia. Although there are way more details that we could elaborate on when it comes to the fascia and the fascial layers of the neck, as an introduction, this should actually suffice.